despite what it says on my lab coat, I'm Dr. Carlos Dator Jr., okay? I'm the medical director here of our wound center. So just a brief overview of how the evening will work. Just a quick slideshow presentation here. I'll open up the floor to any questions that you guys might have, and then we'll do a quick tour of the center and then show you kind of the back of the hyperbaric oxygen chambers that we have here, okay? So welcome again. Thank you for showing your interest here to the Wound Care Center. So how did this project come about? We've obviously focused kind of our efforts, Oswego Health, in strengthening the community, providing services that are offered elsewhere that we don't necessarily have here. So Oswego Health has kind of partnered with this higher big brother organization, Healogics, to kind of help provide care for chronic wounds in the area. A little bit more about Healogics on the next couple slides here. But typically that's kind of where this center started. Healogics is an organization. They have about approximately 800 care centers, some bigger, some smaller, mostly bigger around the country. They see more than 300,000 patients a year. You know, think of it kind of as a library of physicians that we have access to in terms of research, case-by-case patient studies that can kind of help us guide our journey towards healing wounds in the center. With that, and with kind of Big Brother up there looking over us, you know, every month they send us kind of a newsletter, kind of up-to-date techniques, what's advancing in the field. Yearly they send us to a conference where we get retrained on the latest things that are going on in the field. And then on top of that, one of the more important things too is kind of 24/7 access to kind of physicians if we ever run into something that obviously we haven't encountered before, or if we need trouble. So it's just a good partnership for everyone, really, in terms of helping us help you guys in the community. So who are we? Like I said, I serve as kind of the medical director here. In the back we have Olivia Van Sanford. She's our program director. Kristen and Chris kind of help every patient encounter. And then Katie with our hyperbaric oxygen chambers in the back. You'll meet them throughout the tour there. Again, each one of us kind of having that opportunity to kind of learn from Healogics, kind of strengthen our interest in helping the community with wound care here. So what qualifies as a chronic wound? Well, we really are looking for these wounds that have been hard to heal, and we're talking roughly more than 30 days, okay? Different things that kind of lead to this chronic wound or something that hasn't really healed, aging population, prevalence of diabetes, on top of any other chronic disease, hypertension, high cholesterol, and then obesity, okay? These comorbidities all lead into this difficulty sometimes healing these wounds, and that's kind of where we have a role of kind of helping expedite that process when other things have failed. So generally we talked about chronic wounds. Now specifically, these are kind of like the wounds that we see. You know, over here on the list, on the right here, you'll see the list of kind of the different wounds that we might see. Most commonly, our top three, there would probably be your diabetic foot ulcer, okay, a venous stasis ulcer, and then kind of what we call like an arterial insufficiency ulcer. So those are kind of the big three that we typically see, all right? Now, a lot of healthcare has kind of focused to diabetes. you see that in this community where your primary care physicians are targeting diabetes. I think nomenclature in the society, actually a lot of people know what A1C is. You see all the diabetes medications on the TV. Even specifically in the Oswego area, they've opened up a bariatric center to kind of help with obesity, which tends to lead to diabetes. So there's a big push to kind of help prevent diabetes. Once it starts, it has a big effect on the society in terms of just numbers here. Hospital charges have cost about $171 billion in a year. Okay, so this is coming down from the top saying this is something that we can kind of prevent, and if we can't prevent it, this is something that we're targeting to treat aggressively. So because diabetes is such a prevalent disease in the community, it acts specifically in our case because it targets nerves that normally run along in the periphery, like your feet, your eyes, blood vessels that run along there too. And that's why you see your podiatrist and you see your ophthalmologist yearly. And in terms of the nerve damage, if you end up stubbing your toe or you have a wound and you don't know about it, past that 30 days, it might be even more difficult for you to heal with that diabetes on board. So that's why most commonly those are kind of the wounds that we see here in the center, and one of the things that we've kind of focused on treating. Just an example here, this is a 37-year-old male. Again, he works about 80 hours a week as an EMT and also at Costco. So he's on his feet for about, let's give him the benefit of the doubt, 60 hours a week, okay? He started with this wound from his primary care physician, and he was referred here after 2 months of it not getting any better. So you can see kind of the progression that we've seen. We usually do this every week. You'll follow up with us in the wound care center every week with our different strategies, and we've pretty much healed it in 8 weeks, okay? So that's kind of one of the better examples that we can kind of have here. Obviously, certain patients are a little bit more difficult than others, but this is a good example of how 2 months looking like that, and then all of a sudden, in 8 weeks' time, we've kind of almost healed it. And how do we go about doing that? Okay, so just diving in again, generally, what we do here is our center is provider-based. Okay, so not only are you seeing our providers here, but we're getting you in touch with vascular surgeons to make sure that there's enough blood flow and enough nutrients going into the wound so that you can heal it. We're getting you in touch with radiologists so that they can kind of make sure that the infection hasn't really spread. We are surviving on the ER physicians' referrals here, the primary care physicians' referrals here. So we're not an end-all be-all, but it's more, like I said, a community-driven project to kind of help our community and help you guys heal. So just briefly, without going into too much detail, this is Healogic's kind of, and our strategy, our mainstay in how we kind of target how we're going to heal these wounds. Okay, these are our 9 basic steps that we'll go over before each patient encounter, during each patient encounter, and then after each patient encounter. And even after you leave, we'll do it on a weekly basis. Again, I see those papers, so I know that we're doing it 4 times every week. Okay, so like I said, I mean, the things that we're trying to do is just make sure that we're optimizing the things that the wound needs to heal, and then we're treating certain things that are under our control to help the wounds heal. How do we do that? These are our basic tools, okay? So you'll see in a little bit, Katie's going to help us here with a demonstration. We do hyperbaric oxygen therapy if you qualify. We do a lot of surgical debridement, okay, just meaning taking off some of the dead tissue on the wound so that the wound can heal. This negative pressure wound therapy, those are your wound vacs, okay, again, helping the wound be in an environment where it can heal. Compression therapy, that's more for those venous stasis ulcer wounds that we talked about, the top three that we kind of see, because if you're having a lot of fluid in your legs, the fluid's going to stop the wound from healing, okay? And then obviously the dressings that we are able to provide for you. How is that different from maybe someone that you might see like in terms of a primary care physician? Again, based on Healogics and the steps that they've kind of guided us, we have case-by-case research, research-driven practical guidelines that kind of have tailored us to a successful way of reaching our goal. And the wound dressings that we have here probably more extensive, a little bit more than what you might see in the primary care physician office. I know definitely more so than my office, and I work as an outpatient general practitioner too. So again, these are our main basic tools. So we have 2 hyperbaric oxygen therapy chambers, HBO Therapy for short, 2 in the back. Again, these are some of the indications of why you might need it. It's the best treatment if all else fails before amputation. That's kind of where we're at with this. It's scary, maybe losing a limb, and if you can do everything to do before that, then this might be something that someone might be able to go through before then. Okay. Again, that presentation will be in the back. So all this I've been talking about really comes down to we work those 9 steps. We're consistently seeing you on a weekly basis. We're giving you the dressings. We're giving you the wraps. We're aiming to get your healing rate to 93%. Okay, that's kind of what they saw through those 800 centers and the 300,000 patients that they saw. They healed 93% of them on average, right? And on average, it took them 28 days. Again, this is just averages based on their network. Okay, there's some people that are going to be longer, some people that will be shorter, but those are pretty good numbers based on everything that, the research that they've kind of given us. So another reason why, if you've been dealing with a wound that's been there for more than 2 months, you might want to come here to see what we can offer that you haven't yet seen. Okay? So that pretty much wraps up everything that I wanted to say generally. I was going to open it up to the floor for any questions that you guys might have, and then, like I said, we'll get to the quick tour and the demonstration. Yeah?
If a person has been on steroids and their legs swell and they're losing the fluid and stuff, is there a chance that will heal once they stop the steroids?
The steroids?
Yes,
Yeah.
Okay, so then that wouldn't go into wound care?
Well, so
But then it can.
Okay, so I'm just going to rephrase your question. So you're saying if a person's on steroids and it makes their legs swollen,
And bleed.
if taking away the steroids would help them heal, right? Mm-hmm. Okay, tough to say. I think every physician might say that because you don't know. Do we know specifically that it's the steroids that's causing the swelling, or do we know if it's maybe a little bit of diastolic heart dysfunction, meaning your heart isn't pumping as well, so then the fluid's backing up into your legs? Are you not walking as much? Is that what's causing the fluid to stay in your legs? Is it not being pumped up efficiently with the muscles around your legs? Okay. So it's tough to give you a straightforward answer if simply taking prednisone away would help heal that. I'll give you just a brief kind of strategy that we would kind of see is it something to do with excess fluid in your feet? Okay, we want to make sure that if it is excess fluid, is it, like you said, something that we can take away that's causing the excess fluid? If it isn't that, then we'll go to our next step. A lot of that time being, what we do here is compression therapy, okay? Some people get placed on Lasix, right, to kind of get the water out, right? You see that a lot with people with chronic leg edema. One of the things on top of that we've done here is compression therapy, where we're wrapping your legs in a kind of tighter pressure in the bottom, less pressure up top. That way the fluid gets brought back up to the heart so it gets pumped out someplace else, okay? And that alone in itself has kind of helped with those venous stasis ulcers that that I think you're talking about, correct? Yeah, so roundabout way for me to say I'm not sure if just taking prednisone would take your swelling away.
Does it lead to, by having that happen to your body, does that lead to not healing? But based on the history of the person, I would imagine.
Right. So yeah, again, the excess fluid in the lungs within a wound, the excess fluid in the wound in the legs causes the nutrients and the cells needed for the body to heal it to not be able to swim through. If you can imagine that. It's like trying to get someplace with a barrier, that barrier being the water or the swelling in the legs. Does that make sense?
Yep.
Yeah. Good question.
Do I have another question?
Yeah.
What's the question?
Anyone?
You talked about cholesterol.
Mm-hmm.
Is that a factor in not having wounds heal?
So again, when I talk about those comorbidities, you want to think of it in kind of the most basic way to think about it is, in order for a wound to heal, it needs the blood flow. So that's why we're always getting into a vascular surgeon to make sure that the blood flow is able to deliver those nutrients and those cells to help the wound heal. Hypertension, high blood pressure means that there's something blocking the arteries in some way or another, so less blood flow. Cholesterol, same thing. You build up plaques in the arterial walls and you're getting less blood flow. So that's the basis of these comorbidities. Smoking, another thing. Like smokers, they have these peripheral vascular diseases, less blood flow. And so those are the things that we want to try and optimize before we even start getting into the surgical debridement, the dressings, the compression, because we're pretty much putting a Band-Aid over something that you're really not addressing, right? Because the real reason is the blood flow when it's not necessarily just the dressing, okay? So that's why we're real aggressive, and that's why it's kind of a community-wide effort with your primary care provider on top of us helping in all facets of the wound healing process. Any other questions? Sure.
You mentioned the time frame of having a wound that is healing is 2 months before you would attempt to have hyperbaric treatment?
So there's different factors, and actually a lot of it has to do with what Medicare kind of tells us is covered. It's tough. Yeah, it's tough just because it's such kind of a different modality, a different therapeutic way of healing things, that we want to make sure that the burden isn't majority on the patient, and that it kind of, your insurance is going to help you pay for that. So that's kind of, when I say 2 months, I mean they give us specific guidelines that we kind of follow to make sure that it's going to be cost effective for you as a patient. Yeah. Yep.
Familiar with hypoderma
So necrotizing fasciitis, something like that?
I suppose that's another word for it.
Yeah. Okay. So again, like I think that's one of the indications for the hyperbaric oxygen therapy. There haven't been a lot of cases that I've seen personally. Okay.
What about your group?
In terms of who we've seen in the hyperbaric oxygen therapy, I don't think, have we seen a case of necrotizing fasc there yet? No, not yet. Okay, but like I said, it is on one of those indications for hyperbaric oxygen therapy. Again, we have access to a regional medical director who is close by in Fayetteville that has kind of been in the practice for a number of years that can kind of help us guide our treatment if one of those cases came up.
Who's that?
Dr. Paula Pons. Yeah. So, and it's funny that you bring that up because I actually have a patient in the outpatient facility who, you know, if you're going 45 minutes weekly treatment for 12 weeks, you know, it's a burden sometimes, especially with the months coming up. So, you know, us being able to open this facility for the community, the surrounding community, is a little bit easier for him personally, and he's loved it since. So, you know, and he's thanked me a lot, and really it's not me to thank, it's the powers that be that brought everyone here. Any other questions? Yeah, go ahead.
What role does diet have to play in wounds not healing?
Good. Good question. Big deal, right? Because if you're eating pickles and hot dogs, you're not getting the vitamins that you might need to get the wound to heal. And so that is another thing that is guided in one of our 9 steps to, like I said, optimize everything before we start diving into what we can do with the wound. Okay?
If patients are currently at a wound care clinic in the Syracuse area, can they transfer here?
Absolutely. Yeah. I don't think that's such a problem at all. Yeah. Like, so the patient that I saw in my office, he was seeing Dr. Pons in Fayetteville. He said, "Doc, I have to arrange for a ride every week. Can you just get me to here?" And it worked out that way. It's an easy referral process. I think we have a sheet that we've kind of sent out to the primary care physicians, a referral sheet that all they have to do is fill out, and then it gets faxed over to us. Yeah. Any other questions? No? Okay, well, we have a tour set up for you guys. If you haven't gotten refreshments or any snacks, we have that set up as well. I'm going to stick around for a few minutes if you have any questions, and then I'll be going to my second job shortly thereafter. Okay? All right, guys. Thanks for coming.